You know that 25 million Americans have obstructive sleep apnea, and 80% of them even do not know that they have. In this podcast, we will be discussing in detail about what obstructive sleep apnea is, what are its symptoms, how we can query each other to understand whether we have obstructive sleep apnea, how you could communicate with your medical team. Then we'll discuss about home study, some tests, and then the treatment. And hopefully by the end of this podcast, you understand what sleep apnea is. You know, the ironic part is the statistics are horrible. As I mentioned, there are about 25 million Americans have obstructive sleep apnea, and 80% of them do not know. And this is very true to many chronic medical problems. But common link between most of the chronic medical problem, whether we talk about high blood pressure, diabetes, high cholesterol, heart disease, COPD, it comes to our daily lifestyle and vices. If you are diabetic, regardless of how long you have been diagnosed with type 2 diabetes mellitus especially, you have about 70% chances that you have obstructive sleep apnea. The things don't end here. 70% of people whose waist size is more than 38 if they are male and 34 if they are female possibly have obstructive sleep apnea. 45% of everyone who has obstructive sleep apnea have hypertension. So let's wrap our head around how big this problem is. It's very common, risk factors are common, and all the chronic medical problems are tied down into each other. The most difficult part for me personally was we used to think, or at least in our mind, we used to hypothesize that obstructive sleep apnea is a disease of middle-aged and elderly male, less of female, and we didn't think of children having obstructive sleep apnea. As obesity pandemic is getting worse, now we have more and more children who have obstructive sleep apnea. So the message is nobody is immune. Everybody can have obstructive sleep apnea. And the consequences, especially in children, are learning difficulties and behavioral problem. And it is of paramount importance that after we listen to this discussion, we self-introspect whether you yourself or one of your family member have sleep apnea. What is sleep apnea? See, when you breathe in, air from your nose goes in and it passes through the back of your throat, and that path with behind the tongue is a very functionally dynamic part because it's all soft tissue. There is the back of your tongue and the soft part of your palate meat, and these are muscles. If they are kept stretched, there is an airway or passage that the air can go into your lower air tract. But if that does not happen for some reason when we sleep, all the muscles in our body, they relax. Back of our pharynx muscles and tongue is also muscle, and they relax when we sleep. And when we sleep, the air cannot pass through that. And when air cannot pass through that, your body cannot get oxygen. And then carbon dioxide start getting building into your system. And that leads to arousal of your brain, and you wake up and suddenly your sleep is interrupted. You take a big gasp of air, you expel all carbon dioxide, you inhale oxygen, and you sleep. And the cycle keeps on going over and over. In this section, I will show you a small video clip from Mayo Clinic to kind of make you understand what I just now described, and we will build on it as we go. It is happening fast where the air from your nose it has to pass This is the area back of your tongue, back of your muscles, of the pharynx. When you sleep, they move backward and air gets stopped. And depending on how much air is trapped there, you have the issue. If the air is completely cut off, you will stop breathing and you will gap. Most of the time, your spouse will notice that you suddenly wake up or you are grunting, feeling choking sensation. And when you wake up, your spouse can wake you up to breathe. And this is a major issue. And this can happen in night over and over and over. Now, the question always comes in there, why this thing happens? So that's why we need to understand this part of our pharynx or back part of our throat very clearly. This is your tongue muscle and this is the back of your pharynx. And when these both muscles are relaxed, you have a issue that this leads to the potential obstruction of your airways. What can you do? Why this thing happen in some people and why it doesn't happen in everybody? The reason this thing happens here is because this is the area, there is no bony structure. They're both soft tissue or muscles. They meet over there. Above all, when you become overweight or obese, there is a relatively more deposition of fat in this area. Yes, the fat can get deposited here and leading to dynamic obstruction. See, this is not a fixed obstruction. This is a dynamic obstruction. Sometimes it happens, sometimes it doesn't happen, and it depends on how relaxed your muscles are or how deep your sleep is. Deeper the sleep, the more you will have the issue with this. Now, with this mechanism in mind, let's understand the symptoms and how we could diagnose it. We notice that there is a dynamic obstruction to the flow of air, leading to lack of oxygen and building up carbon dioxide. And when these gases build up in our system, they go to our brain and they awaken us. That is the first symptom. You're waking up multiple times over and over. Second, because of this blockages, you get choking sensation. You hear snoring. And once you wake up, your sleep is not refreshing because you never get into deeper cycles of sleep. Plus, you're waking up multiple times over and over. So you will be tired in the morning. So the cascade stops. Your nights are horrible. And then your days become horrible. But if you look at it, 1/3 of human life, if we count that we are supposed to sleep 8 hours every day, is spent while sleeping. During daytime, we all have struggles of life, deadlines, problems. And night is the kind of a getaway from this business of life. And if you cannot sleep, you wake up tired, you are sleepy. Now, it leads to both physical, chemical, psychological, emotional, and intellectual symptoms. Physically, it is primarily a disease of males and obese males. Nobody is immune, as I started in the beginning. Even we are noticing a lot of children have obstructive sleep apnea. But primarily, that is the main group of people who have sleep apnea. Physically, you will be tired. Second, your blood pressure will be high. You will have headache. You will be very sleepy during daytime. That will lead to decreased productivity, lot of accidents at work, motor vehicle accidents. Emotionally, you will be irritable. You will not be able to focus on work, and a lot of people get depressed. And there is a lot of studies which are now confirming a lot of people who claim that they have possible fibromyalgia. They develop basically sleep apnea and they're in a perpetual cycle of that, which we will discuss in a minute. Intellectually, you have a hard time concentrating, and most of us are intellectual workers. You will not be able to perform. Your mouth will be dry. So there is not a domain of your life which this cannot affect, both physically, emotionally, psychologically, and cognitively. And that is a main issue which we must not ignore. These are the few things which are happening, which I am kind of trying to show you in a pictorial form. First is that your oxygen, as I mentioned, your oxygen is decreases during you have the episodes. Then your blood pressure goes up. There is a lot of cardiac dysrhythmias which can happen. Unfortunately, people who have obstructive sleep apnea, they have 2 to 3 times increased risk of developing stroke. There is a more risk to develop myocardial infarction, and it all leads to all the problems, which is the root cause of all chronic medical problems, meaning endothelial dysfunction, your inner lining of all blood vessels, that is the cell which we call endothelial. Once they are disrupted, that's how we make plaques. If we make plaques in heart arteries, we get heart attack. If they develop in the arteries which goes to your brain, that leads to stroke. If it happen in your tummy, we call it mesenteric ischemia, and if it happen in your legs, we call it PAD. Then you have restrictive lung disease, meaning your lung do not expand fully. So you tend to start retaining carbon dioxide. That leads to a whole host of acid-based problems in your body, leading to kidney problems, leading to electrolyte problem. So it's like a cascade which we might go from one to another. I just want to ensure that there are two myths which are very prevalent, and being a physician, I am guilty of that, few of them too. Number one, in my education, I've been a physician for more than 25 years. When we were trained, younger people never had obstructive sleep apnea. Now we need to change our thinking. Second, every diabetic technically should be screened for sleep apnea. If you have a COPD, you should be screened. If you have a chronic fatigue or you have been diagnosed having fibromyalgia, you should be screened. If you have a history of stroke, you must be screened. So you see, name any organ system in the body, it can affect it. And the root cause of obstructive sleep apnea is obesity. In my personal experience, if you lose 10% of whatever you weigh today, there is significant improvement in all domains of life. So we as physicians must not be stereotyping. We must have a broader horizon, and we must screen people for sleep apnea. This is a good place where we should also discuss about another entity. What is central sleep apnea? In central sleep apnea, your brain failed to send stimulus or a command to your respiratory center to breathe. In obstructive sleep apnea, you have an obstruction. The air cannot go in. But in central sleep apnea, your brain fails to send command to your respiratory system to initiate the act of breathing. So what that leads to is it leads to again drop in oxygen level, increasing level of carbon dioxide, and it goes back to the brain and provides the stimulus and initiate the breathing again. It is very, very common in cardiac patients, especially in the patients with congestive heart failure, because for some reason the people with congestive heart failure, they have a high propensity to develop central sleep apnea. Many times you may be on a lot of medications which suppresses your respiratory drive. For example, if you have pain and you're on chronic opioid pain medication, they decrease the threshold and you are high risk for developing central sleep apnea. Or you are on anti-anxiety medications like Xanax, Klonopin, that can lead to central sleep apnea. Then also a few antipsychotics can do that. But biggest is cardiac diseases. It is prudent that if you have any of those diagnoses, you must try to minimize your medications especially opiates and benzodiazepine, which are anti-anxiety medications, to the lowest effective dose, and preferably you should stop. This is very treatable. You do not need to have anything special to be done. Like any other sleep apnea, you will need sleep study. And once you are tested and they have started you on CPAP machine, you have complete resolution of the symptoms. Now, how do you know? That is what I want to educate myself, my staff, and my patients and family and friends. What are the things you need to start looking at home that you may have sleep apnea? We go with the acronym. Like in medicine, there is a lot of acronym because there's information is so much, and we have to come up with the creative ways so that we could keep it in our awareness and we could recall it in a systematic way. There are 4 criteria or 4 validated methods or the questionnaires we have to kind of diagnose sleep apnea. The first one is, we call it stop bang, which stands for snoring, tiredness, observed, meaning your partner or somebody who knows you while you're sleeping have observed that you stop breathing, and you have high blood pressure, and if you have body mass index more than 30, age, and neck circumference. If your neck size is more than 15 centimeters, you are at high risk. Then male gender, and then we score them based on the symptoms. Second is sleepiness scale. In this scale, what we do is we have 8 activities in different domains of life, both at home, work. What we basically assessing in this one is, during daytime, what is likelihood of you being sleepy and sleep inappropriately? Say, for example, in our offices, in the waiting room, people who have obstructive sleep apnea, 5-10 minutes they have to wait, and you will find they go to sleep quickly, or they're waiting in the exam rooms, they go to sleep. So these are scored differently, that how likelihood you are to be sleepy, and we give a scale. Anybody who has a score more than 10 is at high risk to develop sleep apnea. Now, for you to, without making it so complicated and cumbersome, just go with the simple gist of this test is that during daytime, how sleepy you are and how many times you have caught yourself or somebody has caught you being sleepy. If the answer is yes, you have a positive screening test and you should talk to your physician. And this goes in detail of different way we score it. I don't think that is important. In this talk, what I want to give you is a gist of all these validated questionnaires. Some offices will use Berlin questionnaire. Basically, it's testing 3 things. It is trying to evaluate the severity of your snoring, meaning the severity is you just snore, or it is too loud and you stop, you choke, you gasp and start all over again. Second is daytime sleepiness, like we're scoring. And then also, if you have a history of having hypertension or you have history of obesity, all these things lead to a lot of awareness. But the mother of all the tests, gold standard test, is sleep study. I think this is where we must talk. Traditionally, in the older times, if we go 5 years back, if you have a sleep apnea diagnosis more than 5 years, you will find you have to go to a specialized sleep lab, and you go there and they will put a lot of electrodes on your head, and that was to check the EEG. The way we have a heart EKG, we all are aware of that. Same way the brain waves, all the activities of the brain, it goes through beta, alpha, theta, delta, all the different levels of our awareness. As we drift from beta to alpha, we go down in the scale. We can record electrical activities. Then we also record the effort of the breathing, what it takes. Then we record the flow, and then you are sometimes visually have a video surveillance, and your sleep specialist put all the things together. Then they found it out is that technically these extended sleep studies which we used to do, this one is, they technically are not needed. Now the home sleep studies, basically once you have those positive screening tools or questionnaires, they basically clinch the diagnosis. In medicine, you put two and two together. Once you have the right scenario, right examination, you basically have the diagnosis of sleep apnea, but you still want to objectify those symptoms. Now you will find less and less people have to get the traditional sleep study, which we call polysomnography. The reason we don't need to do that is because we are just trying to collaborate the evidence, and the treatments are becoming very effective as we go along. So very few people will go traditional sleep study. What we can do now in this one is on these sleep studies, if you have home sleep study done and you're still not getting adequate response from the treatment, or your physician believes you may have other sleep disorders, then we go for this full sleep study. What we do is there are two parameters, so the technical terms which we use in the traditional sleep. What we are measuring is we are measuring a continuous your level of oxygen, and how many times your oxygen level dips during the night, and how many times per hour it dips. That is called desaturation index. And second thing is how many times when you are trying to breathe, your airway is partially blocked, we call hypopnea, and when they completely block and you have apnea. And then based on that, we make the different assumptions and the treatments. But these days, we do not do it. Now, we talked about the screening questionnaire. Let's assess the risk factors. If we know that we may have sleep apnea and why you need to be screened and why you should have it, I think this is the most important part of my presentation today, is because this will give us all the things. A lot of us tend to ignore, undermine, or minimize our medical problems. If you leave your sleep apnea untreated, you will have a lot of cardiovascular complications. And those are hypertension is part of this thing. Heart disease, meaning you are at increased risk of heart attack, you are increased risk of stroke, and a lot of cardiac dysrhythmias. All of them can kill you. Normally, if you look at the pattern or number of deaths which happen, they primarily happen between 6 a.m. to 12 p.m. Late morning and early afternoon is the time when naturally most of the deaths happen if there are natural causes. But in obstructive sleep apnea, most of the deaths happen between 12 a.m. and 6 a.m., especially at night. Look at the irony. Every time you're having a blockage, you are betting that your brain will wake you up, you will be able to increase the tone of those muscles, and you will be able to take care of your breathing. If it fails one time, you're done. Metabolically, you have very, very high risk of developing diabetes, because the risk factor for obstructive sleep apnea and diabetes is obesity. So it's not something very difficult to understand. Lungs or respiratory care, you will be chronically tired. And then when your lungs are constantly not able to keep up with the oxygen in your blood, the blood vessels in your lungs goes into spasm, what we call eventually pulmonary hypertension. What that means is your right side of the heart has to work hard to pump the blood, leading to heart failure. Then sleep quality and safety. You will have high risk of accidents and very poor performance in all domains of life. This is not something to be joke around. This is something which we must pay attention, and we must not let it go. This is not something which should be left untreated. Next comes in is, now once you come to our offices, what are the things which we are asking for? We will ask you all the questionnaires about your sleep. How many hours you sleep, whether you have difficulty in initiating sleep, and whether you have difficulty in maintaining sleep, whether it's refreshing or you feel tired. Then we will interview your spouse or significant other, how much you snore, whether you stop breathing, and whether you have any limb movements, all these symptoms. And sometimes we get a lot of patients being referred by the employers that they find that there was a guy who was highly productive. Suddenly he's irritable, depressed, anxious, and sloppy. And we do get a ton of referrals from even the employers, because they want to make sure that the employees they're paying productive. Your sleep environment, that's something which is very, very important that you should consider. For sleep to happen, how do our brain understand that you need to go to sleep? It's mediated through a hormone, melatonin and serotonin. As sun goes down, dark sets in. But now in our day environment, because of advent of light, there's not enough dark. Our natural hormones kick in to sleep. So out of all the lights, artificial lights, the blue light especially, which comes out of our computers, TV screens, and our smartphones, is the one which keeps our brain with a signal that it's not dark, he should not produce melatonin. That's why if you have a lot of screen time, you will have difficulty going to the bed. Recommendation is you should stop all electronic or digital activity at least 45 minutes to 1 hour. Second thing which triggers melatonin for you to sleep is light exercise. If you do a little bit of exercise, not heavy exercise, not light exercise, moderate, just something that also gives body the natural trigger. Temperature at home. For your body to go provoke sleep or initiate sleep, the body temperature has to go down. And if you have a split AC, if you could lower your bedroom's temperature 1 to 2 degree as compared to rest of your home, you will sleep. Then sounds, whatever will disrupt your sleep, prevent those parts. So home environment is very, very important. Lifestyle. We must exercise, we all know that, because lack of exercise, obesity is a mother of all chronic medical problems. Make sure we all know how to calculate our body mass index, which is a calculation driven from your height and weight. Go on internet, you will find ton of ways to calculate. If you go to any physician, you could ask them, because that is one of the mandatory part of your vitals. We do that. And we take your blood pressure, we check you for diabetes, we listen to your heart, we measure your neck size for this thing. And then also, if you have any of those problems, any kind of alcohol, that's why if you drink, you are at high risk to develop or worsening of obstructive sleep apnea. Many times we have very difficult conversation with the patients because they want us to give something to sleep. And we look at the profile, whether you have the test of word sleep apnea or not, you may have a high risk to develop these blockages, which we have discussed. Then we don't want to give you the medication, and there is a lot of uncomfortable conversation happen around that part. But whenever a physician is not giving you any sedatives, they are basically trying to keep you safe and healthy. Now, once you come to us with the test, you have screened yourself, or we have asked you the questions, and we put two and two together, then a lot of ways we are trying to get you the diagnosis confirmed for obstructive sleep apnea. As I mentioned, we rarely go to now sleep lab. Most of the studies are done at home. They all employ different methods which I've listed, but the key or basis is the following. Number one, they will look at your desaturation, how many times it goes down. Second, they will look at how much effort you have to exert to initiate your breathing. Then they will calculate your hypop, how many times your airway was partially closed, then apnea, how many times per hour that you could not breathe and you woke up, and multiple awakening time. No matter which study you pick, they all basically are based on the same thing. And it does one method of home study is not better over the other. If your physician is not in agreement with these tests, they could always order the full detailed sleep study. I think I have discussed this obstructive OSA DI index, which is a desaturation index. That is how many times at night per hour your oxygen saturation drops. And if it drops more than 30 times or 6 times, it is positive. And many times we are looking for 3 to 4% drop in your oxygen level. Treatment. The treatment is very simple. Change yourself, that is lifestyle change. There are very few medications which we could give you to help you with that partial or complete obstruction which you get during this sleep apnea attack. The biggest thing is we end up taking way a lot of medications from you, especially pain medications and anti-anxiety medications, because those medications are the problem. And third is the CPAP. And very rarely we refer the patient to do the surgeries. Let's take up all of them in detail. These are the few medications. Basically, they don't do anything with your obstruction in the back of your throat, which happen in the sleep. Those are Diamox, lot of things which we use. These are the medications which are intended to see if we could decrease the dynamic obstruction which happens, and plus these medications are used till you are changing your lifestyle or your sleep study, and the treatment like in the form of CPAP is produces a result, and you are at a job where you are being mentally alert and is required. These medications we use to promote wakefulness. They are temporary fix, very limited use. These medications initially were designed for shift workers, but technically they don't help you with the obstructive sleep apnea. Main treatment of obstructive sleep apnea is CPAP machine. In obstructive sleep apnea, there is a dynamic obstruction behind your tongue and the throat where the air cannot pass. And what we are trying to do is, with this machine, the CPAP machine, goal is to provide a flow of air which happen naturally and provide extra pressure which keep your tongue and the back of your throat separated so that the air can pass. This machine, in my experience, if used properly, has been phenomenal. I have patients who come in after 2 or 3 days of use and feel that they have a new leash on our life. I am going to show you a short clip of a video to kind of demonstrate how this machine provides the positive pressure. In this one, you create a leak around your nose or mouth and nose, and everybody has a preference of whether the nasal piece or the full mask, whatever you could tolerate this one. And this machine continuously, then it becomes a closed system, and this machine provides a positive pressure so that in this area where the obstruction happened, it keeps the enough flow to keep it open. So let's watch it. This is the older animation with the machine. Now the machines have become very smaller, portable, and also they have a lot of they look a lot more fancier than this machine. Now this machine is delivering the positive pressure and keeping your airway open. That way there is no desaturation happening here, no buildup of carbon dioxide, no waking up. And many people find it difficult to kind of stop it. But if you are educated properly and you have can take up your math, I have seen 95% of they can easily tolerate this procedure, and then they will really. So this is basically a cycle which keeps on doing over and over. The goal here is to keep a positive practice. And how much the common question which we asked is what are the CPAP settings? It is the pressure which machine has to deliver to keep your airways open. Most of the time it's between, what we do is we set the pressure between 6 to 10, and then based on how your symptoms are resolving, whether you have stopped snoring, your daytime sleepiness, your energy level, your blood pressure is coming down. If needs to be, we could titrate the blood pressure or titrate the pressure in the CPAP. But now, as technology improving, we don't have to do any of this thing. The machines are we call auto CPAPs. The machine senses how much pressure it must generate, and it is dynamic. So it generates enough pressure to keep your airways open. So this older guess game of dialing the pressure, and those machines were very cumbersome. They were analog machines. You have to program it, and this one is. As technology improves, it definitely improves our life and it helps us with all these parts. Most common questions which we are asked is what are the top 5 or 7 symptoms of obstructive sleep apnea? A. Tiredness, snoring, choking, gasping for air, high blood pressure, obesity. What is the connection between obstructive sleep apnea and heart? We have established that in great detail. It can lead to anything wrong with the vascular system, including stroke, heart attack, cardiac dysrhythmias. Can obstructive sleep apnea be managed naturally? Absolutely. If you lose weight, you could lower or eliminate completely obstructive sleep apnea. Living with obstructive sleep apnea is cumbersome because the biggest challenge which I find in my practice is some people cannot hear the idea of having something on their mouth. They try everything under the sun and they cannot tolerate it. If you are one of those very rare 3 to 5% of the patients, there is a surgical procedure now. What we do here in that procedure is we on the right side, like a pacemaker, we put a generator and it sends a wire back to your throat muscle near the tongue comes in, and then it has a dial. We could program it that if you go to bed at 11 o'clock, 10 o'clock, then that generator kicks in and that keep your muscle, send this stimulus to the muscle while you're sleeping, so the muscles are taut, the airway does not close. We all seeing a lot of ads on the TV regarding Inspire system. That's exactly what it is. It is not as simple as the ad kind of tells that they are throwing the CPAP machines and they are free and all those things. The technique is getting better, but it's still a surgical procedure. The wire has to go in the back of your throat, and also the battery life is about 5 to 10 years. It needs to be replaced and over. Currently, as we are talking today, that procedure is reserved for only severe, very severe or morbidly obese people who have very difficulty in accepting CPAP or be able to use it properly. So to give them a backup system, because it can lead to sudden death. Next question was, what is the science behind CPAP and how it works? With CPAP, we are providing a constant pressure which is over and above the closing ports between the tongue and the posterior of part of your pharynx, which delivers enough pressure with the air. It keeps them open so that you relieve all the symptoms of sleep apnea. In my experience, this is a wonder piece of equipment. It has changed many people's life and prevent countless heart attacks, strokes, and death. Sleep studies, what to expect? Not much. When the study comes in, for a layperson to understand and do that part, I don't think they need to exert your physician is competent. They should be able to take care of interpreting and making you understand your symptoms. And that is one of my wish is to help you to understand sleep apnea so that you could make right choices and help yourself and prevent all the complication. Next question is, what is the right CPAP for me? We have not used in last 4 to 5 years other than auto CPAP because we don't want to go back to over and over this issue that you have to adjust your pressure. The machine is smart enough to understand how much pressure it has to deliver, and it is very, very safe, and that's what we will do. Diet. Any diet which will lead to weight loss has to be a balanced diet, which is predominantly plants, legumes, whole grain, healthy fats, will lead to prevention and treatment of obstructive sleep apnea. Can surgery cure obstructive sleep apnea? If we are talking about throat surgery, we call it uvuloplasty. It is a surgery where they go back and they remove part of the soft palate so that there is nothing for it to block. Yes, that will cure it, but if you continue to gain weight, your soft tissue can grow back. If the Inspire system, where the generator and the like pacemaker, the surgeons who are performing these procedures become good, that definitely has a hope. But problem is, if we cure one problem and we don't go back to root cause of these problems, issues, the common problem, common link between all chronic medical problem is obesity, lack of exercise, undue stress, no pause or time in life to relax and think back, and taking sleep for granted. If we add all these things to our life, we solve a lot of chronic medical problems. You will find that once you become healthy, everything gets better. Your blood pressure is better, sugar is better, cholesterol is better, sleep apnea is better. There is no back pain, no muscle pain, no ankle pain, no knee pain. Everything gets better and everything falls, start getting worse together. I hope I have convinced you that sleep apnea, A, is important to screen. Common symptoms are tiredness, fatigue, snoring, gasping, quitting breathing at night, and being tired, affecting both emotionally, cognitively, and psychologically. We should not ignore it because it has healthcare consequences and it affects predominantly all important organ system in the body. Treatment is very simple. Home studies are very, very easy to get it done, and the treatment is very predictable. Thank you very much for giving attention. Please like, share, and subscribe to our channel, Kundlas MD. Please do comment on our content because that gives us insight into what we should do more, how we could improve. Like always, I'm humble and thank you very much. I will see you next week in new podcast on a different topic. Thank you.